Hi everyone, it's Tower here. So acne seems to be a subject that's been talked about quite a lot recently. It's National Acne Awareness Month as well. So I thought it would be good to just do a short video just explaining a little bit more about acne, what it is, who gets it, what causes it, how it presents on your skin and how you can treat it. So let's get right into it. Acne is basically a chronic disorder that involves blockage of your follicles and leads to inflammation. So chronic means that it can happen over and over and over again over time. Blocking the follicles, the pores, just means that your skin effectively can't breathe and get rid of the debris. And your body's immune system kicks in and creates this inflammatory cascade that leads to the redness and irritability. So who gets acne? In a word, everyone, unfortunately. It can be more prevalent in certain groups like adolescents, so young adults from about ages sort of 14, 15, 16 onwards, right up to their early 20s, although some people can have acne that persists throughout adulthood. You can also get certain other groups like women who are experiencing menopausal symptoms. The changes in hormones across their body can lead to changes in oil production, which can also lead to acne. But more on that in a minute. So really, acne doesn't really discriminate. It can happen to everyone. So what causes it? There's lots of different causes of acne. It can be a family background. So if you've got family members who have themselves experienced quite severe acne, then you're much more likely to do so as well. It can be caused by hormonal changes. As I mentioned earlier, hormonal changes that happen during adolescence and during menopause can also lead to acne breakouts. It can be caused by just the proliferation of acne bacteria across your face, across your body as well. That also leads to breakouts. It can be caused by your body's immune system responding to that proliferation of acne bacteria, leading to redness and inflammation. It can be caused by blockages to your hair follicles, your pores. Certain conditions like PCOS, polycystic ovary syndrome, can also lead to acne proliferation because you've got an increase in oil production in the skin. Certain medications like steroids and hormones can also lead to acne breakouts. And it can also be caused by skincare that's occlusive. And that just basically means skincare that's going to block your pores even more, or even makeup, cosmetics that block your pores even more. And it can be caused by diet. So any foods that are very high in GI or any foods that are high in dairy can also ultimately lead to acne breakouts. So what does acne actually look like? Where does it appear? Most people will experience acne on their face, but some people will also get it on their neck, on their chest, on their back. It shows up as open or closed comedones. Comedones are basically spots. And they can be open, they can be inflamed, very red and irritable. They can be cystic, so they've got a head on them like a pustule. And as well as the acne spots, you can also get changes to the pigmentation in your skin. So you might have dark areas where you've had previous acne. You might have red areas. You might even have acne scars from acne outbreaks that have now healed from the immediate acne pustules, but you're left with lots of scars and rough or uneven texture all over your skin. Obviously, this is going to have a psychological impact on people because acne is on your face and you can't really hide it very well, apart from covering it up with heavy makeup, which paradoxically can actually make the situation worse. Acne can be classed as mild or moderate or severe, and that's based on the proliferation, the number of pustules, and how widespread it is across the face. So in terms of treatment, what can you do and what can be done for you to help you treat acne? Treatments can range from topical creams or gels, either medical grade or prescription even, that contain things like antibiotics to kill off the acne bacteria, or benzoyl peroxide to reduce the oil production. And that can be prescribed by a doctor or a nurse prescriber like myself or a clinical specialist. You can also get a low dose of a combined oral contraceptive to reduce the oil production and to reduce the hormonal surge, to reduce the outbreaks of acne. Your skincare is key here. So use skincare that has proven and correct amounts and formulations of active ingredients like mandelic acid or salicylic acid to reduce the sebum, the oil production in your skin that kind of feeds the acne bacteria and mixes with the dead skin cells on your skin to form this kind of glue that clogs your pores and leads to acne outbreaks. So you need to stop that at the source by reducing the oil production to reduce that cascade from happening. So use medical grade skincare that provides you with a really good cleanser that doesn't strip the skin and cause it to create more oil, but actually maintains the skin's balance. Make sure you're using exfoliators, not mechanical harsh exfoliators that will cause tears in the skin and make the situation worse, but chemical exfoliators that will actually gently reduce the dead skin cells on the surface of the skin as well as reducing oil production. You can also have clinic treatments like skin peels to do that in a much deeper way. You can also use light therapy, intense pulse light or LED, to actually kill off that acne bacteria on the surface of the skin. You can get specific acne patches that will go on individual outbreaks to again help to kill off that acne bacteria. And for the scarring and the pigmentation changes, you can use things like microneedling, radiofrequency or ordinary microneedling to gently retexture the surface of the skin. And in really severe cases of acne, you can get a referral to a dermatologist for a prescription of a product called isotretinoin or Roaccutane. Now, this can only really be prescribed by a dermatologist because it comes with quite severe side effects. So you'll need to be monitored regularly whilst you're on that medication. And there are caveats. You can't use that medication if you're planning to have a baby, for example, because it's been linked to quite serious fetal defects. So there are lots of things that you can do to manage your acne, both at home and with a clinic or with a dermatologist if your acne is very, very severe. If you're struggling with acne, you're not alone, and there are things that can help you. Why don't you give me a call or message me via the usual channels to see how I can help you. I hope this has been really helpful, and I hope you have a wonderful day. Take care and bye for now.